treat like their new peanut butter cookie dough party. The new Summer Blizzard treat menu is one you won't want to miss. Only at participating DQ locations. Happy taste good.
This is the KBLA Sports Minute with Ray Richardson.
The Dodgers are in the middle of another one of their hot stretches. They beat Miami Wednesday for their 7th straight win. The Dodgers are 14-2 in their last 16 games. They lead San Diego by 6.5 in the NL West. In this 16-game stretch, the Dodgers have outscored their opponents 100-31. The pitching staff has a 1.74 earned run average. The Dodgers certainly have earned a day off today. They start a 6-game road trip Friday night in San Diego. The Angels took 2 out of 3 in Pittsburgh. They're back on Friday night against Kansas City to kick off a 7-game homestand. Denver Nuggets center Nikola Jokic was voted NBA MVP for the 3rd time in 4 years. Jokic joins a very impressive list of NBA players who have won at least 3 MVP awards. Kareem, Magic, LeBron, Wilt Chamberlain, Michael Jordan, Bill Russell, Larry Bird, and Moses Malone. No debates, no speculation, just the info you need. That's your KBLA Sports Minute. I'm Ray Richardson on KBLA Talk 1580.
KBLA Talk 1580 is the fastest growing talk radio station in Southern California, home to 50,000 watts and an audience reach of 12 million listeners. KBLA Talk 1580 is a pioneer for black audio content, including our groundbreaking $2 million climate justice campaign and the most loyal, influential audience. According to an independent research study by the polling firm Aviterus, for the 2nd consecutive year, KBLA Talk 1580 is the most trustworthy, reliable, and credible news source for black audiences and beyond in Southern California. Let KBLA Talk 1580 power your advertising dollars. Our omni-channel custom marketing solutions are specifically tailored to connect with your ideal target audience. We leverage audio, podcasts, streaming, digital, social media, and local activations to get your message out to the black community. Get in touch with our advertising team today at advertising@KBLA1580.com. That's advertising at KBLA1580.com. KBLA 1580. We've got your blood.
First things first.
First things first, it's the DU General, Money B. I'ma put you up on the schedule. 6 to 9, 8 weekdays, not 2 and 7. We got a lot to talk about, so much to pedal through. Unapologetic, progressive. Tune in KBLA 1580 to get the map. We're your ancestors' favorite radio station. First black on talk radio on the side of the nation. Me and Dominique DiPrima go way back. Tired of smiling, making sure the station stays black. Discussing all the issues in our community. We're hosted black and brown and others find unity. So let's talk about how baby can improve. Digital underground, always down with the movement. So we tune in. The first things first with the queen of black talk radio, Dominique DiPrima. Go sis.
KBLA Talk 1580. Good morning and God bless. I'm Dominique DiPrima. This show is called First Things First. I think you know that. My first thing today and every day, giving thanks, giving praises, and asking for blessings from God, the ancestors, and the elders, and getting it going. We have a lot to talk about today more than ever. Sticking to the game plan, we typically do hour one. We look at the left coast, what's going on in the Pacific Ocean side of town. Hour two, we go national, international, and beyond. And in the third hour, we do a deep dive with a person or persons of interest. Today we'll be hearing in hour three from Karen Wells, who's the mother of Amir Locke. Say his name, Ms. Wells is seeking justice, and we will get an update on that case. You're always welcome in via phone, 800-920-1580, 800-920-1580, or you can tap in through any of the social medias, KBLA 1580. Whatever platform you're on, we're streaming on YouTube right now. and I'm around at DiPrima Radio. So we've got a jam-packed show today. We're going to jump right into this conversation about single-payer or universal payer, healthcare for all, whatever you want to call it. This has been a conversation in the state of California that is ongoing, and I'm always referencing it because it's very important to me. Now we've got some folks joining us that can help get us up to date on where we are with this fight. Is it really possible? And debunk some of the myths, as well as focus in on calls to action, what we, the concerned and engaged citizens, can do. From California's 25th Assembly District, representing the majority of San Jose and open space areas in southeast Santa Clara County. He was first elected in 2016, becoming the first Indian American to serve in the California legislature in state history, reelected to his fourth term in 2022. Ash Kalra, welcome.
Thank you so much. Appreciate it.
Yeah, I mean, you zoomed. I mean, you've got a lot of priorities, right? Legislative priorities. I see a lot of the work that you've been doing in other areas. But you zoomed right in as a champion of single-payer health care, a system of health care. You introduced AB 1400 in 2021, and we know it as CalCare. Now you have updated that, and you're still pushing to try to get some kind of single-payer. Why is this such a top priority for you?
Well, it's a top priority for so many Californians, so many Americans, really, even if they don't know the nuts and bolts of what would make the system better. I think everyone recognizes our system is broken. They know the system, Californians know the system is broken because of how much money they pay for their health care, how much they have to wait for services, and heaven forbid they don't have health care at all or don't have real access, and they have to make really tough life choices that lead them down a disastrous path. So it's very real. It's something that's not always front of mind for everyone every single day, but it impacts every Californian, whether they know it or not.
Yeah, I think that's right. I remember, the whole conversation around Obamacare, which is not single payer because we still we still keep the insurance companies in charge. But I just remember people saying it wasn't an economic issue, and I couldn't understand that when so many families go bankrupt because of medical bills. I mean, it's one of the number one things that pushes people into houselessness and all kinds of other economic distress, right?
That's correct. And even with Obamacare, medical debt is still the number one reason why families go bankrupt. Right now, the number one population entering into homelessness is our senior population, or at least at the highest rates we've ever seen. And for a big part of those individuals, it's because they get some kind of medical issue, which they can't keep up with in terms of having to pay for the bills.
Yeah.
They lose their apartment, lose their housing. And so it has a spiral effect, and it's absolutely an economic justice issue.
I want to bring in another voice, couple voices here. Sheila Bates is an organizer with Black Lives Matter Los Angeles and Black Lives Matter California. She leads the policy team, the healing justice team, and she's also a full-spectrum birth worker, so touching in the health space as well. Sheila Bates, good morning.
Good morning, Sister Dominique.
Why is healthcare, single-payer healthcare, something Black Lives Matter is interested in? It doesn't seem like front and center for what the kinds of things you might work on.
That's a great question, and there's a lot of reasons for it. As Black Lives Matter, we seek to end state-sanctioned violence in all of its forms, and one of those forms is definitely economic. And as Assemblymember Ash Kalra already uplifted, this has a deep impact on economic impact on our communities, and particularly in the Black community. We know that Black people are more likely to be uninsured or underinsured. We know that also Black people are more likely to be deeply impacted by medical apartheid. And CalCare not only addresses the economic and financial barriers that are seen by and experienced by Black people, but it also directly addresses the impact of medical apartheid, and which is the inadequate care that Black people receive when we go to the hospital and when we go to seek care at our doctors, because we have social determinants. We experience social determinants of health that directly impact our health, and these things are no fault of our own, right? Black women are 3 to 5 times more likely to die in childbirth than white women. Black infants are 2.3 times more likely to die than white infants. We are more likely to have certain types of cancer. We have a lower life expectancy. And this isn't things that we did on our own. It's the fact that the medical system doesn't actually treat us with the care that we deserve. And so these have a ongoing impact on our life. And recognizing all of those facts, it was something that we absolutely had to engage in, and that over the last few years we have steadily increased our engagement around knowing all of those things, because we've all been directly impacted by this in some way or another.
And finally, I want to bring in a lead regulatory policy specialist at the California Nurses Association. She's been policy specialist since 2016. She was legal counsel at the California Nurses Association and National Nurses United, and an attorney fellow at the Employee Rights Advocacy Institute for Law and Policy. Carmen Comsti, welcome.
Well, good morning, and thanks for having me.
Yeah, thanks for joining the conversation. I'm not sure people are really aware how involved California Nurses Association is in trying to bring single payer or health care for all to California. Why are the nurses on board with this, and what kind of work on the ground are you doing to try to get this thing across the finish line?
Yeah, the nurses of the California Nurses Association, the largest union of registered nurses in the state, have been concerned about the failures of our broken healthcare system for decades, and have been pushing for single payer healthcare for decades as well. And for nurses, for our members at CNA, they see every day how the lack of healthcare access to affordable healthcare, where costs are driving people away from receiving the care that they need, hurt the patients that they see, and it hinders nurses' ability to actually provide the care that they know they have a professional duty to provide. And I think one of the highlighting what Sheila was just talking about, I think for nurses, they fundamentally see that a single payer system will help everyone in California join together to say everybody should get the health care that they need. Healthcare should be a right, and the economics of it is that we will save money and provide more care if we move to a single payer system. And as nurses, it's just a fundamental duty to ensure that patients get the care that they need. And this is why nurses have fought for universal guaranteed health care for all for decades, both on the legislative side, working closely with Assemblymember Ash Kalra, and on the side of getting education out there about how we fix our broken healthcare system with folks like Black Lives Matter California and Sheila. And I think nurses know that we need to organize and uplift everybody in the state to move towards a more just healthcare system.
Assemblymember Kalra, that is since Attorney Comsti brought it up, that is the number one thing we hear about single payer or universal health care, is that we can't afford it. It's too expensive. It sounds good on paper, but there's just no way.
Whenever someone is saying that, it's usually someone that's profiting wildly off the current system, or it's someone that's just not necessarily fully informed because they've been gaslit by the industry because of the false narratives that have been put out there. Whenever someone says we can't afford single-payer health care, the first question I think we should ask them is, how are we affording our current system? But how are we paying for it now? Because we have the most expensive system in the world, and we're all paying for it in one form or the other, whether it's in hard cash or with our lives. And so, as Carmen just indicated, every legitimate study has shown that single-payer health care will save tens of billions of dollars a year in California alone. We know this. The industry knows this as well. And so there's no doubt that it will take a lot of really good policy work, a lot of really smart folks, some of whom are on this interview right now, to figure out what the best manner is to create a single-payer system. But no one can say that a single-payer system will be more expensive and be intellectually honest at the same time.
And part of the reason for that is because we pay more for the same services that other people who have similar systems get, right? Our health care, per procedure or per course of treatment, it costs more than anywhere else, right?
That's correct. We pay more for less services in many ways. I take care of my father, and he's on Medicare. I've seen him pay thousands of dollars for dental and vision care because it's not covered. I don't know why at some point dental and vision was not considered a part of healthcare, except again for the profit of those private companies that make a whole lot of money by ensuring that it's not considered part of guaranteed health care under Medicare. And so it's examples like that really show that despite this kind of sense of American exceptionalism that somehow we're best at everything, all the data shows that not only do we have the most expensive by far of wealthy nations, of any nation, but we have the worst outcomes of any wealthy nation by far. And it's a shame. California is the fifth largest economy in the world, and we have people dying because they don't have health care.
We're talking about what will it take to get health care for all. Health care as a sort of basic, you guys hear me talk about this all the time, a basement. What is the floor that which we will not allow folks to fall beneath in the state of California or for our nation, and how can we as people who call ourselves progressives, people of good conscience, not support something that can provide such a sorely needed services. We're talking with Assemblymember Ash Kalra. We're talking with Sheila Bates of Black Lives Matter California and attorney Carmen Comsti of the California Nurses Association. And if you've got questions, confusion, hateration, 800-920-1580. I'm Dominique DiPrima for Unapologetically Progressive, KBLA Talk 1580.
She's reclaiming her time on KBLA Talk 1580. More First Things First with Dominique DiPrima when we come forward. We've got a lot to talk about.
Are you interested in catching up on all the latest entertainment news, trending topics, and exciting interviews? I got you. Tune in to The Raw Report with Robin Ayers, Monday through Friday, 6 to 7 p.m. I'm your host, Robin Ayers. Join me every weekday with some of the best entertainment contributors in the business as we break down what's going on, who's got next, and what not to miss. Only on The Raw Report with Robin Ayers.
Unapologetically progressive. KBLA Talk 1580. We've got your black.
To help combat climate change, LADWP is helping neighborhoods have better access to electric vehicles by awarding nearly $130 million in EV rebates to customers just like you. From big savings on used EVs to building new charging plazas, LADWP is charging ahead to help all Angelenos experience the benefits of EVs. Get rebates of up to $4,000 for a used EV and $1,750 for a charger. Learn more at ladwp.com/EV. That's ladwp.com/EV.
Hi, it's Tavis Smiley. First, thank you for your support of KBLA Talk 1580. We deeply appreciate you. So, I get asked all the time, Tavis, when are you going to bring back that State of the Black Union symposium you used to do? You know the one where you had all those black intellectuals on stage every year and everybody watched all day live on C-SPAN? Yeah, I know the one. Let's bring them back. Well, I am pleased to tell you that if you go to KBLA1580.com right now, you can sign up to be in the audience here in Los Angeles when we go back live on C-SPAN with a stage full of black thinkers and influencers for a historic conversation. America has never seen a stage full of black folk talking about the urgency of now. Climate justice, climate equity, climate resilience. It's going down Tuesday, June 18th, 4 to 7 p.m. at the California Science Center in Exposition Park. Admission is free, but you must register at KBLA1580.com. Once we reach capacity, you'll have to watch us on C-SPAN. But if you want to be in the room when we go live from Los Angeles, Tuesday, June 18th, head to KBLA1580.com right now to reserve your seat. Caring about the climate, caring about the community. With KBLA Talk 1580, we've got your black. I'm a keep up today.
City of Los Angeles landlords, verify your tenant's Emergency Renters Assistance Program status today. Tenants approved for rental assistance are protected from eviction for non-payment of rent through May 31st, 2024. Approved rental assistance applications protect tenants from eviction for non-payment of rent. Refusing to accept rental assistance based on their source of income is illegal under law and can be used as a defense in an eviction case. Check your tenant's application status now at housing.lacity.org. That's housing.lacity.org.
What's up, family? It's Slink Johnson here for Original Taco Pete, home of the tasty black taco. Come enjoy our delectable menu at 3272 West Slauson Ave off Crenshaw, right off the K-Line. Catering and delivery is available through Grubhub, Uber Eats, or at originaltacopete.com. And don't forget to bring a veteran this Veterans Day, and they'll receive a free taco. Thank you for your service. See you there.
Your ancestors' favorite radio station, and your favorite morning show host. Let's get back to Dominique DiPrima right now.
Right now, we're talking about universal or single-payer health care, and what an incredible panel. Ash Kalra, Assembly Member from the 25th District, is with us. Sheila Bates of Black Lives Matter California and leads the policy team for BLMLA as well. Attorney Carmen Comsti with the California Nurses Association, all here. And I want to start once again with you, Assembly Member, because let's talk about your bill, what it actually does and where you are in the process with it. This is round 2 for you, I believe.
That's correct. So AB 2200 would set up CalCare, which is the policy bill that outlines exactly what our single-payer system would look like in California. So it outlines what services are covered. It outlines payment process. It outlines a governance structure. So it's basically the nuts and bolts of what a single-payer system would mean for California. And the reason why it's focused on policy rather than the financing, how we pay for it, is because of the structure that's been put before us by the federal government. And so essentially, once we pass a policy bill, then we would go to the federal government and apply for what are called Medicare waivers, essentially asking for permission from the federal government to use federal funds and consolidate it into one CalCare fund where we would combine state and federal funds, have some kind of a financing mechanism on top of that would get rid of premiums and copays, but find some other mechanism that's not attached to employment to make up the difference, and that would be our overall financing plan. But we don't get to that until we pass a policy bill. And AB 2200 did pass the Health Committee, and right now it's awaiting the Appropriations Committee, which is always a challenging committee to get any bill through, but especially right now because we do have a big budget deficit. But I'm hoping because the way that the legislation is set up that it literally says in the legislation that the CalCare does not go into effect until the financing has been determined. So I'm hoping we'll have the opportunity to have the policy bill move forward and go to the full floor of the Assembly. But essentially, by around this time next week, we should know if it's made it through the Appropriations Committee, and then it'll be heading to the floor of the State Assembly.
Appropriations, a.k.a. the money people, the money committee.
Right.
Yeah, so that's a big hurdle. But getting it out of healthcare is a huge step, too. I mean, we as, regular citizens that don't deal with the Assembly all the time may not realize what a big deal that is. It seems like a no-brainer healthcare policy coming out of healthcare committee, but that was a huge step forward, right?
It was, and we just got it through. Just got the exact number of votes we needed. But at the end of the day, you don't need to get it through by excess votes. You need just the right amount of votes to pass it through. And so I'm glad that it has allowed not just the conversation to continue, but the bill to continue moving forward, because we've had a lot of conversation about single-payer health care in California over the decades. And I think it's time to stop talking and start acting.
Yeah, Carmen Comsti, we have had a lot of conversations over the years, and there's so many different sort of talking points, or I won't even say scare tactics, that have been used to bat this down. One of them is that we'll have some kind of rationing of care, and we won't get the health care on demand or the health care that we need. Not like we're getting it now, but I do hear this talking point. How do you respond to people who have those worries?
Yeah, this is something that we hear a lot, and we have proof from the dozens of other systems in the world and other countries who have a single-payer system, where we know that the type of rationing of care that we have today in our profit-driven insurance system doesn't happen under other single-payer systems. And I think one of the beautiful things about CalCare and our single-payer bill, AB 2200, is that we create the structures in our CalCare system to ensure that these issues of ensuring that everybody has access to the providers and the hospitals and all the different nurses and doctors that they need are addressed. We have an Office of Health Equity in our CalCare system that we formulated in AB 2200, and we're really trying to get at this issue of health inequity and making sure that the system works for providers so that everybody is getting the care that they need. I think one of the fundamental things that is failing in our current for-profit health insurance system is that, Black and brown people are seen as cuts to the bottom line. It costs more money to provide low-income communities of color with care, and that's the thing that we're really trying to fundamentally address, is the inequities, the structural inequities in our healthcare system. And with CalCare, we can say, maybe we should attract more nurses and doctors in areas where our for-profit system hasn't been able to attract these types of healthcare workers. Maybe we should reopen a closed hospital with the savings that we're getting instead of paying for profit or administrative costs to insurers. And that's really, I think, one of the fundamental things about how single payer won't have the care rationing that we have today. We're really reevaluating how we spend our healthcare dollars as a people.
Okay. We got news, traffic, and sports right here, and then we're going to continue this crucial conversation about how we get health care to Californians as a fundamental right. KBLA Talk 1580.
More of First Things First with Dominique DiPrima when we come forward.
Thanks for joining us, everyone. I'm Mike Moore. Now here's the latest from the Black Information Network. Stephen Munchin says he's still interested in buying TikTok. The former Treasury Secretary under Donald Trump told Bloomberg Television he's spoken to several tech companies about how to rebuild the app. President Biden recently signed a law requiring the Chinese company ByteDance to sell TikTok or have the app banned in the U.S. Georgia's appeals court will consider former President Donald Trump's appeal of a decision to not remove the district attorney from his election interference case in that state. In March, a judge ruled Fulton County DA African-American Fonnie Willis could remain on the case if Special Prosecutor Nathan Wade was removed from that case. Trump had tried to have Willis disqualified over a romantic relationship with Wade. And that's the latest. I'm Mike Moore from your 24/7 news source, the Black Information Network and BINnews.com.
Hey, DQ fans, cool off with their new summer blizzard treat menu. Try new picnic peach cobbler or snag a perfect beach treat like their new peanut butter cookie dough party. The new summer blizzard treat menu is one you won't want to miss, only at participating DQ locations. Happy tastes good.
This is the KBLA Sports Minute with Ray Richardson.
The Dodgers are in the middle of another one of their hot stretches. They beat Miami Wednesday for their 7th straight win. The Dodgers are 14-2 in their last 16 games. They lead San Diego by 6.5 in the NL West. In this 16-game stretch, the Dodgers have outscored their opponents 100-31. The pitching staff has a 1.74 earned run average. The Dodgers certainly have earned a day off today. They start a 6-game road trip Friday night in San Diego. The Angels took 2 out of 3 in Pittsburgh. They're back on Friday night against Kansas City to kick off a 7-game homestand. Denver Nuggets center Nikola Jokic was voted NBA MVP for the 3rd time in 4 years. Jokic joins a very impressive list of NBA players who have won at least 3 MVP awards. Kareem, Magic, LeBron, Wilt Chamberlain, Michael Jordan, Bill Russell, Larry Bird, and Moses Malone. No debates, no speculation, just the info you need. That's your KBLA Sports Minute. I'm Ray Richardson on KBLA Talk 1580.
We ask seniors how to prevent Medicare scams.
My best advice, if you get a phone call, do not talk to the person. These people are well-trained. Don't talk to them.
They don't know me. They're just trying to scam me.
Don't be fooled. Hang up. Just hang up.
Never give out your Medicare number.
They're going to get your number and put in a false claim.
If I get a call from someone, I don't pick up the phone. And should I pick up the phone and they ask for information, then I hang up.
How do you detect Medicare fraud?
Just like I check my credit card statements, I check my Medicare statements monthly.
Scammers can get a hold of your number, order medical devices through your account, and you're not even going to know about it if you don't look at your statement. Check your statement every month.
If you get your statement and you see something that you know you did not have done, you report it.
Call your senior Medicare Patrol.
To report Medicare fraud, call the Senior Medicare Patrol at 855-613-7080.
Life can throw unexpected challenges our way. Black families need support. Children require safe, loving, temporary homes. Research shows that children in foster care thrive best when they remain in their own communities. The strength and love within the Black community can provide a sense of belonging. We need your help to consider opening your hearts and homes. Contact fosterlakids.org today or call 888-811-1121. Again, 888-811-1121. Become a foster parent today.
My friends swim no matter the season, but my moderate to severe plaque psoriasis can sometimes take me out of the moment. Now, thanks to Skyrizi and Clear Skin, count me in. With Skyrizi, Risankizumab Riza, a prescription-only 150-milligram injection for adults who are candidates for systemic or phototherapy. 3 out of 4 people achieve 90% clear skin at 4 months.
Don't use if allergic to Skyrizi. Serious allergic reactions and an increased risk of infections or a lower ability to fight them may occur. Before treatment, your doctor should check for infection and tuberculosis. Tell your doctor if you have an infection or symptoms such as fever, sweats, chills, muscle aches, or cough, or if you plan to or recently received a vaccine.
Thanks to Skyrizi, there's nothing on my skin, and that means everything. Ask your doctor today about Skyrizi, the #1 dermatologist-prescribed biologic in psoriasis, and visit skyrizi.com or call 1-866-SKYRIZI to learn more.
When you get nachos, tacos, empanadas, spicy queso with jalapenos, Pepto-Bismol's there.
Pepto-Bismol provides fast, effective relief from nausea, heartburn, indigestion, upset stomach, and diarrhea. All the things that can happen unexpectedly on vacation. So before you travel, pack the Pepto. Pepto-Bismol.
When you have nausea, heartburn, indigestion, upset stomach, and diarrhea.
Use as directed. Keep out of reach of children.
Prescriptions require an online consultation with a healthcare provider who will determine if appropriate. Restrictions apply. See website for details and important safety information. Subscription required. Price varies based on product and subscription plan.
Hey guys, did you know there's a generic form of Viagra that works just the same, but is 95% cheaper? And you can get it online? Go to hims.com/joy. Through HIMS, you'll get a free medical consultation, discreet shipping if prescribed, and the process is 100% online. To start your free online visit, go to hims.com/joy. That's HIMS.com/JOY.
Thanks for waking up with Dominique DiPrima on KBLA Talk 1580.
And I do appreciate you waking up with us. Today we're waking up talking about universal or single-payer health care. And we couldn't have a better panel of experts. Ash Kalra is an assembly member for the 25th District, Northern California, and a past chair of the Progressive Caucus here in California. Sheila Bates, Black Lives Matter California, and leads the policy team for BLM LA as well. And attorney Carmen Comsti, who is with the California Nurses Association, part of their policy team. And I want to pivot back to you, Sheila Bates. What is the difference between universal health care, single payer, Medicare for all? We hear, and now CalCare, which is what we're talking about right now.
So CalCare is actually California's response to all of that, right? And it really is CalCare is California's single-payer health care bill that is on is up for consideration right now, that just passed through the Health Committee and is moving to appropriations and hopefully will make its way to the governor's desk. And this bill is actually it's important. You mentioned before that, that there were a lot of conversations. There were also a lot of studies. We have to remember that this bill was actually put forward as a recommendation from the California Reparations Task Force, that this bill has been proven time and time again to be economically feasible and to actually save us money and save lives, most importantly.
Yeah, when we talked off the mic, Sheila, you were really emphasizing on the money savings. Assembly member Kalra mentioned it as well, but you really made a strong case for why this is, because to me that's the biggest rap on Medicare for all or single payers. They always say we can't afford it, there's no way, it'll bankrupt our state.
Yeah, we pay more money per capita in this country for healthcare than any other country and have nothing to show for it. We have the worst healthcare outcomes when we pay the most. That doesn't make any sense. And this bill, as Assemblymember Ash Kalra mentioned, actually it's strictly a policy bill. It's not even anything related to financing. So this should easily make its way through appropriations. Not to mention the fact that this bill would actually save the state of California money, as well as saving us as individuals money, which then means that helps the economy to grow. If we all have more money in our pockets because we're not spending money on healthcare for our premiums, for our deductibles, to pay for our prescriptions, to pay our copays when we go to every single doctor visit, right? And then you get a bill afterwards, oftentimes, for labs, if you have to go to the hospital, if you have a baby, for crying out loud. And so this would actually put money right back into the economy, because when people have more money in their pockets, they spend money on other things. Not that I'm advocating for that, but I'm just making the argument, not that I'm advocating for people spending more money. Save your money. Let's not continue down this capitalism, catastrophe that we're in, but just proving the point that it just makes economic sense. And that was not meant to be a pun, but it really does make so much sense. And more importantly, it saves people's lives. And it also generates revenue and it creates jobs. So when we're just thinking about it from an economic standpoint, it really does make so much sense. And I think for us as anti-capitalists and as abolitionists, this is also so incredibly important because healthcare is a human right. And as abolitionists, not only do we believe in tearing down systems of harm, but we believe in creating systems of care, which is exactly what this bill is. Because we have to remember that a single-payer healthcare bill is a form of public safety.
Assemblymember Kalra, first of all, I was shocked when I read you were the first Indian American to be in the state legislature. That head explodes now. I mean, because we have so many, East Asian and Indian folks in the state, it doesn't even make any sense at all. I did not know that, so congrats, I guess, on breaking down a ridiculous barrier. But, I think you said, or I read somewhere, that you have upgraded or updated this bill, this new iteration of it. Carmen mentioned the equity piece, the Office of Health Equity. What else is new in this version of the bill that you think makes it stronger?
It's definitely stronger, and we've been taking feedback, and by me, I mean our sponsors, the Nurses Association, in my office, have taken feedback, and we keep incorporating it and making it better, and that's why we need the bill to move forward to continue to get that feedback. And so in addition to the Office of Health Equity, we have assurances for gender-affirming care. We also will have a special advisory committee regarding pensions and some of the issues that some of the unions have regarding, how do they ensure that money they put into the system isn't just given back to the employer, but actually the workers can benefit from that. And so there's a number of other items as well that really focus on ensuring that there's access in rural communities and underserved communities, making sure that what we're seeing now under our current multi-payer system of hospitals closing in urban communities, like it's happening in East San Jose right now, where a hospital owned by Hospital Corporation of America is, shutting down units, including the trauma center in East San Jose, and that's happening around the state, both in urban communities as well as in rural communities. That's a big hot topic right now in our state. Are hospitals closing down in areas where there aren't many options at all, and so we've added protections to ensure that not only does everyone have meaningful, true access to comprehensive care without spending any money out of their pocket, but that care is going to be accessible in every corner of this state, whether you're in a lower income community, whether you're in a lower income rural community that that doesn't have access currently. We're going to make sure that we provide incentives to get physicians, nurses, and other practitioners out into those communities where right now there isn't really a great incentive to do that, because the folks deciding it right now tend to be these corporations that are profiting wildly off our system. And if they can't make enough money in those communities, they won't go in those communities, or they'll shut those hospitals down, which puts even more strain on our county health services in our 58 counties in the state, and they don't have the capacity to pick up the slack. And so we can flip the whole script and make sure that we're actually focusing on putting our resources where it's actually needed, not putting our resources just to ensure that these corporate millionaires and billionaires can just get even richer and buy a yacht or their fourth house or whatever. Instead, we can make sure that money is going back into the pockets of Californians, and more importantly, if they have care anytime that they need it for the services that their doctor and their nurse says is necessary.
Carmen Comsti, you are obviously over the regulatory policy. You're working with CNA, the California Nurses Association. In the chat, there's conversation. Our YouTube chat always is a parallel conversation. Ben Frank says proper care is most important. Courtney Edwards said some of our own seniors can't get health care or even doctors that look like us. And Ben says senior care is insane. Assemblyman Kalra mentioned that in terms of seniors getting out on the street houseless, and I do see people unhoused people, holding medical bags or, devices, and clearly they're not getting care. So I guess the question is, how does this improve the outlook for seniors, and how do we, we talked about rationing of care, but how would we ensure quality of care?
Yeah, that's a really great question, and I think I think one of the big things about CalCare is that there would be guaranteed long-term supports and services for all, and I know right now in our current system, access for our aging folks are to healthcare is really difficult, and I think one of the things that I think Sheila kind of referred to this is that all of the studies that have been done on single payer, they've looked at this question about can we afford it with this expansion of benefits to all Californians, and the Healthy California for All Commission in 2022 said that yes, a system with long-term care for everyone in California and full benefits from dental to vision to hospital care to primary care with no cost sharing and no copays out of people's pocket in the point of where you get your services would still save the state anywhere between $32 billion with a B and $213 billion with a B over 10 years. So we know that there are savings in the system even with expanding benefits, and that the question of making sure that quality care happens, we can use that savings to make sure that care goes into the decisions on care go into the hands of patients and doctors and nurses and providers. And I think that's one of the really important things of CalCare is that we're getting rid of the middleman insurer that's behind the scenes saying like, well, you don't get your back surgery, you're not going to get paid to get your hip surgery or going to a skilled nursing facility for your parents or and get the care that you need. We're taking out that profit making decision maker, those corporate board members that are making decisions on care, and putting it back to the folks who have a professional duty to make sure that you get the care that you need. And I think one of the fundamental things is that we are trying to remove these kind of non-healthcare administrators and middlemen that are creating barriers to care for everyone. So trying to make sure that we're really trusting both the patients and our providers to make those decisions is really important. And then ultimately addressing the question of ensuring that our providers are appropriately culturally competent and have the language needs of our patients is really important too, because we know that fundamentally our healthcare system has issues of structural racism. So ensuring that we get more folks that look like Californians into our healthcare professions is really important too, and we can use those billions of savings to make sure that happens, and ensuring that everybody gets the quality care that they need.
We're talking with Carmen Comsti, the lead regulatory policy specialist at California Nurses Association, Sheila Bates, an organizer with Black Lives Matter California and leads their policy team for BLMLA, and Assembly member for the 25th District in Northern California and chair of the Committee on the Judiciary in the Assembly, Ash Kalra. Our conversation, single payer or health care for all, CalCare, what the bill is calling it, and we are going to get some calls to action and more when we come forward on KBLA Talk 1580.
KBLA Talk 1580 is an intervention. When we come forward, it includes you. KBLA Talk 1580, turning pain into power.
Hey there, Los Angeles. This is James Lucky Jr., publisher and editor of Los Angeles News Observer.
Are you hungry for news that matters to you and the African American communities of Los Angeles? Well, buckle up, because we got the scoop you've been craving. Stay in the know and never miss a beat with our free weekly publications conveniently available near you. Or hop on the digital wave and become an exclusive subscriber at OGNSC.com. Don't forget to join the party on Instagram and Twitter at OGNSCINC for behind-the-scenes access and sizzling updates. No more FOMO. Let's stay informed, connected, and empowered together.
Tips to help improve your credit score in 2024. Establishing credit is an important key to achieving financial health, but building a credit history from scratch can feel challenging since you need credit to build credit. First, what does it mean to build credit? All consumers have a score between 300 and 850. You want your score to be as high as possible as lenders look at your credit score to make loan and credit decisions. A good credit score shows you have a track record of borrowing money responsibly. Remember, it's never too late to build or rebuild your credit. This segment is sponsored by J.P. Morgan Chase & Company.
We see a lot of news about teens vaping, but teens see something else. Videos on social media that glamorize it and downplay the dangers of nicotine. How can parents talk so kids will listen? Use facts. 1. Nicotine can rewire teens' brains. 2. It can make teens more anxious. 3. Changes to the brain can be permanent. So even when it hides behind a new look, nicotine is brain poison. Go to undo.org for more.
City of Los Angeles tenants and landlords participating in the Emergency Renters Assistance Program, beware of scammers. Notifications about your application will only come from the City of LA in emails ending in lacity.org. Protect yourself. Contact the LA Housing Department by email at lahd.erap@lacity.org or call 866-557-7368 to check communications you receive about the program. You can also verify your application status at housing.lacity.org. That's housing.lacity.org.
I'm going out with the girls this weekend. Nails done, outfit stunner, and my skin, I know it's going to be glowing because I glammed up my shower routine with new Olay Indulgent Moisture Body Wash. It smells so luxurious and moisturizes deep into my skin with its super rich, creamy lather that's bursting with vitamin D3. So my skin glows and my confidence grows. Try new Olay Indulgent Moisture Body Wash for glowing skin in just 14 days.
It's time to upgrade your wellness. Experience Unboxed Wellness Your Way, presented by Health Matters Clinic, to unlock access to tools, tips, and local resources designed to empower you. Whether you're drawn to an energizing hip-hop yoga session or eager to boost your business or personal financial well-being, Unboxed has something tailored just for you. Get your tickets to join us on Friday, May 31st, 8 a.m. to 8 p.m. by visiting www.healthmatters.clinic. Free event sponsored by Los Angeles County Department of Mental Health.
Find a righteous rage, and don't be afraid to say what you see. For KBLA Talk 1580.
Man, time flies when you're talking about important stuff. So much to cover here when we speak on single payer or, healthcare for all. And I want to go back to you, Assemblymember Ash Kalra, because I want to get real basic here. Your bill is AB 2200. Assuming this bill were to pass, the governor were to sign it, tall order, but let's say it happens, and then that policy, allows us to consolidate funding so that we can actually restructure the way we do healthcare in California and pay for this new system. What's the end result? Talk to me as if I was 8 years old, Assemblymember. What's the end result after this successfully makes its way from the governor's desk to the feds, to the state, and it's funded and ready to go?
The end result is that Californians will no longer have to worry about what happens if I have a medical emergency. How do I pay for treatments that I need? How do I pay for my medication? And that's a very freeing type of feeling. I think it really unshackles Californians in many ways. It frees up California businesses who pay a fortune. It also does something that's critically important that's not always talked about when we think about single-payer health care. California and the United States is very unique in that it attaches your health care to your employment. And that is a way of really taking self-determination away from individuals. Because if your health care is attached to your employment, that means you're not going to be as likely to speak up if there are issues on the job. You're less likely to move around from job to job if you rely on that health care and don't know what your next step is. If your partner, if you have your health care because of your partner, you may not want to leave that relationship, even if it's abusive, because you can't afford to lose your health care. It's a racial justice issue. We already know some of the data, as was indicated by Carmen and Sheila. Over generations, we have seen the disparities in health care, and they're getting worse. During the pandemic, in the first year alone, Black life expectancy dropped 2.7 years, and that is in many ways directly related to the quality of care that Black Californians and Black Americans have access to. It's a gender justice issue, particularly because we know that in particular women are more likely to be reliant on their partner for health care, and in many ways don't receive the same quality access to care as men, especially because our healthcare system has been set up to be very male-centric in terms of how care is allocated. So what this really means is that every Californian, regardless of their immigration status, regardless of their gender, regardless of whether they're rich or poor, or what quality of insurance they have now as it's dictated by their job, every Californian will have their right to health care established. And that means they can go to the doctor for any of their health care needs, even some that are currently not covered under public types of health care or even some high-quality private insurance. Everything will be covered. Long-term care will be covered.
And it'll be free.
Yeah, it'll all be free. It'll all be covered. And the way we're able to do it is by, first of all, taking the profiteering out of our healthcare system, which amounts to tens of billions of dollars a year, taking the administrative costs, which also amounts to tens of billions of dollars a year. You remove those two items, and you have cost controls that are put in place in addition to equity put in place. Then what you have is you have a system that's focused on care and focused on what a patient needs and not on greed. And that is what Californians can expect if we're able to get CalCare across the finish line and make it a reality here in our great state.
And it could even spread. I mean, one would hope California's led the way on many things, good and bad. So hopefully this gets spread.
That's a very real. I mean, that's the idea. In Canada, it started one state at a time, and that's functionally really how it should be. In Canada, and I visited Canada and spoke to some of the experts there. They have state-run, but they get some help and funding from the federal government. It will be similar here. We would still get federal funding similar to what we get now for a variety of federal programs, and if we would just pull that money together, we can negotiate on behalf of 40 million Californians to reduce costs and make sure everyone has quality care.
Just 60 seconds, Sheila, call to action.
Yes, we need folks and people to call particularly the members of the Appropriations Committee. Buffy Wicks is the chair, and Assemblymember Buffy Wicks is the chair, and she is based in the Berkeley, Oakland area in Northern California, and we need people to call her and really make it clear to her why it is important that this bill passes and she gets this bill out of her committee. So that way we can get it to the desk of the governor, who ran and won on the fact that he wanted to create single-payer health care. Because this bill, we have to remember that also this really helps people who are parts of unions, right? Assemblymember Ash Kalra brilliantly said, what we legislate, we don't have to negotiate. That means that union members get to focus on other things that are really important to them. So I really urge everybody, and we as Black Lives Matter California and Los Angeles really urge everybody to call the members of the Appropriations Committee, especially the chair, Buffy Wicks, so we can help pass this bill.
Assemblymember Ash Kalra, Sheila Bates, and Attorney Carmen Comsti, thank you so much for your clarity and insight on this important issue.
Thank you so much.
Thank you so much for having us.
Thank you.
And we've got a lot more going on around here. As usual, this is the perfect time to call me, 800-920-1580. We are KBLA Talk 1580.
KBLA 1580 Santa Monica.
Thanks for joining us, everyone. I'm Mike Moore. Now here's the latest from the Black Information Network. Stephen Munchin says he's still interested in buying TikTok. The former Treasury Secretary under Donald Trump told Bloomberg Television he's spoken to several tech companies' election interference case in that state. In March, a judge ruled Fulton County DA African-American Pawnee